Dr. David Kahler from UVA Orthopedics is joining us today on our house call to talk about hip fracture, something we all have to start considering, especially as we get up there in age. I imagine age is one of the at-risk factors you have to consider.
Well, it is for both men and women, because as we age, we lose bone gradually over time after we're fully grown.
So how do you diagnose somebody that has a hip fracture?
Well, it's usually fairly obvious that the hip is involved on physical
Sure.
examination, but we need x-rays and sometimes a CAT scan to fairly characterize the fracture pattern.
And just the minor form, a hip bothering you, I imagine, is extremely common as you age.
Oh, sure, yeah. Arthritis of the hip.
So when somebody has a hip fracture specifically, what kind of treatments are they looking at?
Well, it really depends on where the fracture is. You're talking about an area of the body where you can break the socket, you can break the ball, you can break the neck, or anywhere down below that area there. And each of those locations are treated differently.
Is one of those more common than the others?
Yes, the one right below the ball, what we call a subcapital fracture, is very common. If that's not too displaced, we can just pin the hip. When people talk about getting their hip pinned, they can be talking about a wide variety of operations, sometimes even including hip replacement for a displaced fracture.
And on the other end of that spectrum, what's the most extreme kind of aspect of this you deal with?
Well, I do complex fractures as well, so we see the younger people as well who are in car wrecks or fall from great heights and break their hips that way. It can occur in young people as well.
All right, interesting. Appreciate your time tonight. Thank you, sir.